When your doctor writes you a prescription, you expect to be able to fill it on the way home. But what if your health insurance company won't pay for the drug? And it's the only drug approved by the Food and Drug Administration to treat your disease. Tonight in a Target 8 report, KUMU 8's D'Anthony White takes a closer look at a practice known as step therapy.
If I do too much today, I'll be down for the next 2 days with a flare, or maybe longer.
Robin Skinner has lived with fibromyalgia for 20 years, and the type of flare she's talking about is common amongst fibromyalgia sufferers who overexert themselves doing the things most people take for granted.
A flare can last from a couple hours to a couple months.
For Skinner, simply getting out of bed in the morning can cause severe physical pain. Skinner fought with her health insurance company to get LYRICA. Since last June, LYRICA remains the only drug therapy approved by the Food and Drug Administration to treat fibromyalgia. Skinner's health insurance provider required her to try and fail a list of other drugs before the company approved LYRICA. Industry experts call this policy step therapy, while Skinner says it's just been a series of barriers preventing her from getting the medication she needs.
We're going to make it difficult for her to get them. Not that she can't get them, but we're going to make her jump through a few more hoops to get them. That's the way it makes me feel.
Step therapy alters the doctor-patient relationship, giving health insurance companies the power to override a physician's medical judgment.
The company's trying to practice medicine without a license, I feel. In addition to that, they are sometimes excluding the fact that these patients have been through 10, 15 years of all these other different kinds of treatments.
These documents, obtained by KUMU, show several health insurance companies, including Coventry Healthcare, the largest provider in mid-Missouri, use step therapy.
Many of the insurance carriers hope to limit their losses, of course, by limiting some of the treatments available to their clients. What they tend to do is tend to give you something that's cheaper.
They're an insurance company. Expensive for who? Them? They're an insurance company. Isn't that what they're there for?
That was KUMU 8's D'Anthony White. Coventry current policy requires its members to prove failure for 4 separate medications and see a psychiatrist before the company will pay for LYRICA. Mercy Health Plans require similar steps before it'll cover LYRICA. Tomorrow at 10 on KUMU 8's D'Anthony White, we'll take a look at the fight over prescription LYRICA. Jim?
All right, Angie, thank you very much.